Hello, welcome to this video. My name is Tyler and today we're going to be going over the NHS Dentistry 2026 changes. So at the time of filming this, it's actually no changes are around yet. It's March of 2026, so April is just around the corner. But yes, this is great for anyone that just wants to know what's changing, but especially for those dental applicants that want to know a bit more about how the NHS is structured and what changes are coming to dentistry in 2026. So, the April 2026 changes. So, there has been discussion in Parliament for years about having a reform to NHS dentistry, but in July 2025, it was confirmed that there will be some changes and there'll be some big changes. Now, it was discussed in December 2025 that these changes will come in April 2026. Now, lots of people such as clinicians, so dentists, dental therapists, etc., associations such as the BDA, the British Dental Association, a big one to remember for your interviews if you can, and the public have been arguing for changes for years. Now we're going to look at the actual changes that are coming. Now, before we get into the changes, it's very important that you realise we're going to go over the top 6 that I feel like are most important for this video, but there are some other small changes coming. So if you want to have a research about what other changes are coming, make sure to look at the BDA, for example, or have a look at the NHS website. So firstly, we have increased payments for urgent care of patients, minimum contract value for urgent care, complex treatment plan pay packages, denture modification payments changing, fluoride application reform, and last but not least, fissure sealant changing from band 1 to band 2 under the NHS. Now we'll dive deeper into each of these in more detail now, so make sure to stick around. So let's say a patient comes in with a toothache. Right now, dentists will get paid 1.2 UDAs for that treatment, okay? So for example, let's say they get £13 per UDA. You times that by 1.2, so they'd get £15.60. Now, this is the old system. Now, if we have a look at the new system, so the April 2026 system, if the patient comes in with a toothache, the dentist, instead of getting paid in the UDA format, they'll get £75, okay? So they get £15 even if the patient DNAs, which means does not attend, and £60 once the treatment's completed. Okay, so even if the patient does not come to their appointment, even though it's booked in, the dentist will still get paid £15 for that appointment that's been missed. Now, this is great because right now, if a patient does not attend their appointment for an urgent appointment, the dentist will not get paid anything, okay? So this could perhaps make dentists want to work in the NHS more. Now, the minimum contract value for urgent care is also changing under the NHS. So let's imagine we have a dental practice here, okay? Now, the dental practice basically is given money each year by the NHS so that they can spend it on NHS treatment costs, okay? Now, from 2026 April, 8.2% of this money that's given to the practices for NHS treatment costs should be dedicated towards urgent care. So this is where patients come in and they have maybe a toothache, or they have an abscess, they have infection, or maybe they have trauma to their teeth. So 8.2% of this money each year should go towards urgent care. Now, if we look at an example, just so you can understand, let's imagine the dental practice is given £300,000 of their NHS contract value each year. Now, 8.2% of this would be £24,600, which should be dedicated towards emergency care. Now, obviously, in my opinion, this is a very, very good thing because now people are able to access urgent care a lot better, hopefully. And also dentists are able to perhaps even build their skill sets by seeing more patients with different urgent treatments needed. Now we're going to have a look at complex treatment plan pay packages. So as you might know from your research, under the NHS, no matter how much treatment a patient needs, it will all fit into one band and the dentist will be paid the UDAs of that band. So as an example, let's look at Bob, our patient here. Let's say Bob has a treatment plan of 3 fillings, 1 extraction and fluoride varnish application. Okay, now if you're confused about the UDA system, I did make a video on this, But under the UDA system, this would basically be band 2 of the UDA system, okay? So the dentist will get paid 3 UDAs, okay? Now, let's say another patient that looks exactly like Bob has a treatment plan of only 1 filling. The dentist actually will still get paid the exact same for both of these treatment plans, which is very unfair because one would take maybe, let's say, 5 appointments, but the other would take only 1. And this is why they're going to be releasing the pay packages for different complex treatment plans. So here's an example of what the NHS have released as their payments for the different complex treatment plans. So there's 3 different pathways with higher payments for more complex treatments. So as an example, let's look at 1. So pathway 1 is where there's basically 5 or more teeth with caries into the dentine and no unstable periodontal disease. Now, the treatment can be carried out over 6 months and the dentist will receive £284. Now, next is that denture modification payments are changing. So let's say a patient comes in and they have their dentures, but let's say they need a treatment plan of a wisdom tooth extraction, XLA means extraction, and also a denture reline. So a denture reline is where the denture doesn't really fit too well, so it just needs to be added on some more wax onto the denture so that it fits better in the patient's mouth. Now, this under the current system is under band 2. So the dentist would get 3 UDAs. However, there will be an extra 2 UDAs from 2026 April for a treatment plan that contains a denture adjustment, such as a denture reline. If a denture modification is needed alongside other band 2 treatment, the dentist will receive 2 extra UDAs for the denture modification. Now, this is great because you might not be aware, but lab bills to send dentures back to get them basically repaired, lab bills are quite expensive, and the dentist actually has to contribute a lot of their own money to repairing the denture because the lab bill will charge them. So these 2 UDAs hopefully should be able to reimburse the dentists for their money that has to go to the lab. Now, another thing that's changing is fluoride application reform. So reform just means change, by the way. So under the current system, if a dentist wants to make a treatment plan that only consists of fluoride varnish application, this could not be completed as a treatment plan. It's not enough to be a treatment plan. But from April 2026, you can. And another thing that's great is that dental nurses are now encouraged to see the patient and apply the dental varnish, okay? Only dental nurses that have dental varnish application qualifications are able to do this, but they're able to see the patient without needing an exam from the dentist first, okay? So this is great. Another thing that's great is that the treatment plan can be closed and the dentist will get 0.5 UDAs for this treatment plan, even though really it's just the dental nurse that's done the work and done this fluoride application, and the dentist won't even need to see the patient first for an exam. Now, one of the main reasons why the NHS is having this change is because the NHS are trying to focus more on preventative measures such as fluoride application to strengthen teeth and hopefully minimise the risks of decay. Because at the moment, NHS dentistry is very emergency based heavy, but the NHS are trying to reform it so that hopefully there's a lot more preventative measures occurring. Now, last but not least is that fissure sealants are changing from band 1 to band 2. So here I'm showing you a picture of what a fissure is, okay? So a lot of people get confused what fissures are in teeth. They're basically pits in the teeth, okay? So you can see it's outlined with that reddish line. It's the pits in the teeth. Now, these pits or fissures can harbour lots of bacteria and they're very hard to brush. The bristles in your toothbrush are very hard to reach into these deep fissures, and so bacteria can basically grow a lot in them. Now, fissure sealants, as shown from the picture below, they're basically just filling materials that basically fill up those fissures and make them a bit more flat so that your toothbrush can actually reach these areas and bacteria can find it harder to hide and not get brushed away, basically. So it decreases the risks of decay hugely. And it's usually done on children and it's usually done on molar teeth. Now, these are actually going from band 1 currently to band 2 in April 2026. Now, one of the reasons why this is occurring is, one, because it does take time for the dentist to do this. It is a treatment, but also it's so that dentists can be encouraged to do fissure sealants more. A lot of dentists avoid them because they think, oh well, it's under band 1, I don't really get paid much for it. But perhaps if they're under band 2, they'll be more encouraged to do these because they'll get paid better for it and they'll get reimbursed better for it. Now, this is another aim of the NHS to encourage more preventative measures to decrease the risks of decay. Now, that is it for the contents of this video. Now, why should you understand this? First, it demonstrates an understanding of how the NHS dental contract is changing. You can understand that NHS dentistry is constantly evolving. You are able to give examples of how NHS dentistry is being reformed. You can make conclusions on why changes are needed in dentistry. And it shows that you understand why people complain about NHS dentistry. Now, that's the end of this video. I really hope you found it useful. If you did, please make sure to subscribe to this channel and maybe like the video if you can, and comment if you have any questions, and I'll see you in the next video. Bye bye.